Ganglia are small nodules formed of collections of neurons and connective tissue. Ganglia are present outside the central nervous system. They are of two types, craniospinal and autonomic, which include sympathetic and parasympathetic ganglia. They are similar in their structures, both sympathetic and parasympathetic. Comparison between spinal and sympathetic ganglia. For easy differentiation between both, we have to consider the structure and function of each. Spinal ganglia are present mostly at the dorsal roots of the spinal cord, while sympathetic ganglia are present mostly in the sympathetic chain structure. Spinal ganglia are covered by thick connective tissue capsule. Nerve cells of spinal ganglia are of different sizes. They may be small, medium-sized, or large. The size may range from 15 to 100 microns. Nerve cells are rounded pseudo-unipolar neurons. They are arranged in groups or rows separated by myelinated nerve fibers and connective tissue fibers. Nerve cells are capsulated by satellite cells or flat cells. Sympathetic ganglia are covered by thin connective tissue capsule. Nerve cells of sympathetic ganglia show a uniform size, maybe about 25 micron. Nerve cells are stellate multipolar neurons. They are numerous, scattered in the ganglia, and are separated by non-myelinated nerve fibers. Nerve cells of sympathetic ganglia are surrounded by few satellite cells or flat cells. In spinal ganglia, the axons of nerve cells may become convoluted between the cells and their capsule, forming glomeruli. Such glomeruli are not present in the sympathetic ganglia, as nerve cells are multipolar and their axons are not convoluted. Spinal ganglia are poor in blood supply, and there are no synapses between the neurons. The reverse occurs in sympathetic ganglia. They are rich in blood supply, and synapse is present between the neurons. Synapse is the point of contact between the processes of the neurons, and is the site of transformation of impulses and informations between neurons. Structure: synaptic or terminal pattern. The axon at its termination at the site of synapse is swollen and contains many mitochondria, neurosecretory vesicles, or synaptic vesicles, containing neurotransmitter substances as dopamine, acetylcholine, norepinephrine, and enkephalins. The plasma lemma of the axon at the site of synaptic contact is slightly thickened and is called presynaptic membrane. The synaptic vesicles release the contents and fuse with the presynaptic membrane for renewal. Postsynaptic membrane is the thickened plasma membrane of the nerve cell receiving impulses. The cytoplasm of the postsynaptic region lacks synaptic vesicles and shows fewer mitochondria than in the presynaptic area. Synaptic cleft is the narrow space about 20 nanometer in diameter between pre- and post-synaptic membranes and may contain fine filaments and glycosaminoglycans. Classification of synapses. Synapses are classified in different ways. According to function, synapses are classified into chemical synapses, which convert electric signals or impulses into chemical signals that pass from presynaptic to postsynaptic cells, as in cholinergic synapses, which occur in pre- and post-ganglionic parasympathetic and in pre-ganglionic sympathetic synapses. Norepinephrine is the neurotransmitter of both ganglionic sympathetic synapses. Electric synapses, which transmit ionic signals at gap junctions across pre- and postsynaptic membranes, conducting neuronal signals directly. Mixed type or chemical and electric synapses together, in which ionic signals inside the terminal pattern fuse with the synaptic vesicles, thus releasing the chemical transmitters into the synaptic cleft by exocytosis. Classifications according to site. Axodendritic, between the axon of one cell and the dendrites or spines of the other cell. Axosomatic, between the axon of one cell and the nerve cell body of the other. Axonic, between axons of different cells. Dendrodendritic, between dendrites of different cells. Somatodendritic, between dendrites of one cell and the nerve cell body of the other cell. Somatosomatic, between nerve cell bodies of adjacent neurons. Degeneration. These are the changes occurring in the neuron, which is the nerve cell and its processes as a result of injury of the axon by a knife, trauma, or infections. Types. Retrograde degeneration. These are the changes which occur in the nerve cell as a result of partial injury or cutting of its axon. The changes are in the shape, size, nucleus, cell organoids, and cell inclusions. The nerve cell swells, loses its processes, and becomes globular in shape. The nucleus becomes bikinetic and eccentric. Nasal granules become fewer and smaller and then disappear. Nasal granules are very sensitive to any toxin and to mild injuries. They break into small particles and disappear, a condition which is called chromatolysis. They can be observed by methylene blue or by hematoxylin stains. Golgi apparatus as well as neurofibrils degenerate gradually and finally disappear. They can be stained by silver. Mitochondria also disappear. Valyrian degeneration. These are the changes which occur in the axon myelin sheath and neurolemma after partial cutting of the axon. The axon becomes dull gray in color and fails to transmit nerve impulses. Changes in the axon. The axon first becomes swollen and irregular in shape. Neurofibrils appear tortuous and beaded. On the third day, the axon is segmented, and at the 10th day, it appears finally granular, then starts to disappear. Changes in the myelin sheath. Nodes of Ranvier are widened, and the internodal segments retract and become irregular in shape. The formed segments are termed fermentation chambers, in which fat splits into fatty acids and fat globules. The remnants of the myelin sheath are engulfed by phagocytic cells. Changes in neurolemma. Schwann cells increase in size and number to connect the proximal with the distal stumps, thus helping regeneration. Traumatic degeneration is a rapid Valyrian degeneration that occurs in the nerve fiber at the site of trauma. Transneuronal degeneration. It is the degeneration which occurs as a result of deprivation of a neuron from all afferent fibers which make synaptic contact with it. The cell body degenerates, a condition called transneuronal degeneration. The axon also of the cell undergoes Valyrian degeneration. Stains of degeneration. Silver stain demonstrates the changes in Golgi apparatus and neurofibrils. Osmium is used for the stain of myelin sheath. Basic stain for demonstration of the changes of Nissel's granules. Weigelt-Pell stain. It stains the normal tracks of the white matter, myelinated nerve fibers. The sites of completely degenerated nerve fibers appear unstained due to complete disappearance of the myelin sheath. Malshi stain. It demonstrates myelinated nerve fibers, which are the tracks during the process of degeneration. Potassium dichromate is used first to oxidize the myelin of the normal tracts. When osmium is used next, it stains the degenerated tracts. However, it cannot stain the previously oxidized myelin of the normal tracts. Regeneration is the process of healing of the neuron and its processes after injury of the axon by a knife, trauma, or infection. It depends on viability of the cell body, whether it remains intact or dead, the degree of nerve injury, whether it is partial or complete cut of the axon, and the distance between the two cut ends, the state of the wound, if it is infected or not, and the state of neurolemma, if it is intact or not. Regeneration of the nerve cell body. If there is no infection in a partially cut axon with intact neurolemma, regeneration starts in the nerve cell by resuming its normal shape with central vesicular nucleus and prominent nucleolus. The cell starts to synthesize Nestle's granules, regeneration of the axon. If there is no infection in a cut axon, regeneration starts by Schwann cells, which increase in size and number to connect the proximal with the distal stumps, guiding the regenerating nerve fibers to their right position. Neurofibrils of the central stump will grow and extend to the distal cut end of the nerve, directed by the neurolimbal tube. Otherwise, surgical sutures are needed to join the cut ends of the neurofibrils. Regeneration does not occur in the central nervous system due to the absence of Schwann cells and failure of oligodendrocytes to behave like them.